Hi, everybody. So here's part two, and part two of variations in sexual behavior. And we were talking about masochistic disorder and sadism. Excuse me. So, although sadistic disorder is illegal, you'd have to ask, well, if the person who is the object of that behavior is willing at first, when does it cross the line? And it's easy to tell the difference when there's destruction of the body, when there's destruction of tissue, when there's injury. But in terms of sexual masochistic disorder, this would be something that we would call this disorder a masochistic disorder if there's impairment or distress. If there's not impairment or distress, if they're not feeling anxiety, in other words, anxiety, guilt, shame, or other negative reactions to this behavior, or if they don't feel like it's out of control, if they're not being physically damaged, then we don't consider it a disorder. We consider it a sexual interest that's unusual. This is up to the clinician, as are most of these. It's a clinical decision about whether it rises to the level of a true paraphilia. Okay. Let's talk about fetishistic disorder. Fetishistic disorder is an unusual sexual interest in non-living objects for at least 6 months, and that could be in terms of fantasy or enacted behaviors. And there are different kinds. Technically speaking, fetishisms involve non-living things, and the word partialism is a better description of people who have a special erotic interest in parts of the body that are not usually sexual parts of the body. So they're not erogenous zones, or they're not a typical place that the average person within a culture finds sexually interesting. Okay. Now, this is usually harmless. If the person is in a relationship, we can expect the partner to eventually become weary of it if it escalates, and they may lose that relationship. It only becomes dangerous if it rises to the level of utter loss of control of ethical internal guidelines, and they begin to steal things like shoes, or in some cases there are individuals who have tackled women on the street and stealing their shoes. I know this sounds odd, but yeah. For partialism, I have a video of one of the bachelorette bachelors who talks about his foot fetish, and they show a scene in there where he's going a bit crazy and starts to act a little bit infantile because he is touching this bachelorette's foot. And it's a very strange sort of thing, but anything can be eroticized. Anything can become an obsessive object, an object of obsession. Okay, so as these things, whatever they are, whatever the fetish, whatever the paraphilia is, in this case fetishism, as it becomes more severe, then you can actually see the transformation of wanting to be with a partner. So they might want their partner to wear certain kind of shoes, and then they may at some point want to masturbate onto the shoe, or they may wish to then have the shoe and masturbate into the shoe, and then after a while they're not interested in their partner anymore. That at the point at which it becomes a necessity to have that object present in the sexual behavior within a couple, then we call that's where we're not only abnormal, but now we're talking about obsessive behavior, compulsive or obsessive, and it becomes a substitute for a real partner. And so over time, all of these paraphilias that we might talk about, we'll cover some, are people who begin to lose their social skills. Once they enact these behaviors and it rises to a severe level, they erode their social skills. They really lose the ability to connect with real partners. Yeah. So let me go to the next thing here. I want to talk a bit about transvestic disorder. There are many people who think this isn't going to be a disorder in the coming version of the DSM-5, which is likely to be the DSM 5.1 or the next edition, because there's really no inherent typical results from cross-dressing. These are usually heterosexual men who often have partners, some of whom approve, who dress up as women, even to the point of perhaps the undergarments and the makeup and wigs and so on, and they have a social evening. It is not a paraphilia. It is not an obsession with the clothing. You see, and there's no real distress involved, unless they are the victims of crime in some way because they've dressed up, or because they have lost a relationship because they insist on the dressing up and the partner won't permit it. Many transvestites even just fantasize about this, or they wear undergarments and no one knows. So this is often thought by people to not be a real disorder. That is to say, it doesn't rise to the level that the typical ways in which we think of disorders. We will see. And it's not gender dysphoria. That's an entirely different designation. So they identify with their anatomical sex and gender. And it's not transsexualism. They don't want to change. They don't want to become, in the case of males dressing as females, they don't want to become women. They have no interest in that at all. They don't even feel sexual arousal while cross-dressing. So, not typically anyway. Okay. A few more things. Let's talk about frotteurism, frotteuristic disorder. Individuals with this disorder either fantasize about rubbing up against people in crowded places like buses or trains during rush hour, or more likely, they actually engage in that. They'll often wear loose-fitting clothing, cut a pocket out. These are usually almost invariably males, and they do know the schedule of the trains and the buses that will be packed, and they arrange themselves slowly but surely to be up against usually a female, not always, but and they rub themselves or make an effort to fondle the female from behind usually. And it's very difficult to prove these, but I can tell you that most of the stations of the transit police in New York subway system, have bulletin boards packed with pictures of known frotteurs, so that they can keep an eye on them or what have you. It generally takes, one study showed, 500 or more acting out episodes of frotteurism before they're actually caught and prosecuted. It's very hard to prove. Well, was that somebody bumping into you, or hard to tell. It's really, really gross, isn't it? Yeah, that's the word I use, gross. Okay, the last one I want to talk about is necrophilia. And necrophilia is fantasizing about or engaging in sexual activity with a deceased person. Again, the 6-month duration of this is required for the diagnosis. These are people who, if they act out or fantasize, will work in morgues, funeral homes, work for a medical examiner's office, something like that. They don't typically. It's not true that people who are in this group are grave robbers. That's very unusual. But what they will do is they will often engage in autoeroticism with the corpse. A subgroup of serial killers will do this as well. They will torture, kill a victim, and then have sex with the body. Another word comes to mind there, and that's gross again. The personality type of a necrophiliac is very interesting. They are very socially withdrawn, go figure. They are unable to tolerate the true intimacy that's required with another person as you build a relationship. The surface of them may just look a little bit awkward, but this is an issue. They have poor social skills and cannot tolerate the closeness that is usually required in building a relationship. Okay, oh, let me do one more. I can do one more. How about voyeurism? This is another 6-month window where a person fantasizes or engages in spying on someone who doesn't know that they're looking at them as they engage in dressing, undressing, sexual activity, bathroom activity, that kind of thing. And they will spend a lot of time staking out the neighborhood and watching patterns of movement and see who enters the bathroom and the bedroom and when, and figure out which windows are best and put a camera in. Or you'll see people who put cameras in dressing rooms and so on at malls and so forth. If I were female, I would check everything if I went into a fitting room. I don't mean to make you paranoid, but it's rare, but it happens. So it's non-consensual, and let me question you. If a husband saw his wife go into the bathroom and close the door, and she began to undress, and he cracked the door open and peeked, would that be a voyeuristic behavior? If a male goes to a gentleman's club, also known as a strip joint, and he sees women taking their clothes off, is that voyeurism? And if so, yes. If no, why not? Interesting. Okay, got to do one more. And the next one is, let's see, the next one is, what do I need to do? Exhibitionistic disorder. That's a good one. Then we'll close on that. That is where an individual arranges some way in which they can expose their genitals. It's almost invariably male, exposing to females and or children. And here's what the thing is. They are after any huge emotional reaction. I have treated this disorder, and I have talked to individuals, and what they almost always say is some version of the following. They'll say, what I like is to imagine that the person that I've exposed myself to is shrieking because they can't believe it, how big I am or how amazing I am, or I like to shock them, and I get a thrill out of that. And they almost always masturbate at that time or thereafter. So this is not only illegal, but it causes immediate impairment and distress. If they're caught, they'll lose a job, they'll be registered as a sex offender just like the rest of these folks in these various paraphilias. And so this can really, really change everything for them. And I've seen people in very highfalutin, a couple of people in very highfalutin, high levels status jobs who were involved in this. Okay. Interestingly, this disorder sometimes comes as a result of head injury. That's kind of interesting, but it's more likely to result from lots and lots of emotional abuse and family dysfunction. These folks who are males generally are in a relationship, and they have a very subservient role to their assertive female partner. That's usually the way it is. And you want to rule out other things like schizophrenia and PTSD and mild cognitive impairment, depression, and so on and so forth. So that's a look at some of the paraphilias and alternative sexual behaviors, and I hope you learned some things out of that. Comment below on the video and subscribe if you would. Thank you.